Dr. Karen Gerlach, Associate Professor of Breast Imaging at MD Anderson Cancer Center.
And I'm Dr. Kanchan Phalak, Associate Professor of Breast Imaging at MD Anderson Cancer Center.
We're going to talk about microaggressions and how they affect our practice as radiologists. We're going to address a few questions that have arisen regarding microaggressions.
So our first question is, where do microaggressions come from?
First of all, humans all possess what is called unconscious bias. This helps humans simplify the processing of vast amounts of information and group them in bundles. Think about prehistoric times. When you encounter a wild animal, you would have to immediately classify it as an animal that you can hunt or domesticate or as a predator. This process of classifying information has allowed humans to quickly access and categorize a new situation. Flash forward to modern times. One modern example of unconscious bias may occur if a patient only sees females in the role of a nurse. The patient's brain then categorizes every female in the clinic as a nurse. If this patient one day encounters a female physician, the patient's brain has learned to classify women in a clinical setting as a nurse. This concept can apply to any work setting, cross-cultural situations, different age groups, and both men and women.
And the key factor here is to remember that the humans do this automatically and likely may not realize that they're doing this. And that's where the danger lies, when these hidden biases are unrealized. They may result in behaviors that create disparities and microaggressions. So what are the different types of microaggressions? That's our next question. There's 4 general types of microaggressions. Our first one, microassaults, are the most overt and intentional. And that's where the person committing the microaggression knows that his or her behavior might be hurtful. An example would be where someone uses an ethnic slur or derogatory term to refer to a colleague. Our second type of microaggression is called a micro insult. And this can be more subtle. A comment such as, "You've passed your physics board examination." "I haven't met many people from your background who are smart enough to do that." Or calling a female physician a nurse because she's a woman. The speaker expresses implicit biases about someone's background. Our third type of microaggression is a micro invalidation. And this is a comment that denies the experience of a marginalized group. An example would be, "You're being too sensitive. Racism or sexism doesn't exist anymore." In effect, what these statements do is invalidate the experiences and challenges certain groups have faced. Our last type of microaggression is something called an environmental microaggression. And that's when the microaggressions we just described are reflected in the culture and processes of the workplace. So an example would be a building where a wall of portraits of former chiefs of staffs featuring only Caucasian males are hung, or when the closest breast pumping area is located several buildings away. These structural features may convey a message that certain groups don't belong there. Our next question is, how can microaggressions negatively affect job satisfaction and team dynamics? Microaggressions are damaging in the workplace, and they elevate a person's daily stress level. They reinforce that a person does not belong and are not in the in crowd. So experiencing these higher levels of microaggressions have actually been linked to lower mental health, and this can ultimately affect job satisfaction, team dynamics, patient safety. And for example, an employee may hesitate to speak up when he suspects an error due to fear of being wrong or even humiliated by colleagues. Interestingly, these can even cause historically underrepresented people in leadership positions to hesitate about speaking up. And that's really because they can be in fear of fulfilling stereotypes.
The next question we received is, where should people go if they need help managing overt and disruptive behavior in a colleague? First of all, microaggressions can be very difficult to address. The reason for this is they can be presented as a joke or a veiled compliment. You may walk away feeling a little confused and thinking, that was sort of a compliment, I think. It is important to realize that microaggressions are common occurrences, and each individual can address these at the time of occurrence. First, you need to listen to your emotions or guts and recognize if the comment is hurtful. Next, you can never be faulted for expressing how you feel. Speaking up is a mechanism to advocate for yourself and your fellow colleagues.
So our next question is, what are some strategies to promote a respectful workplace culture? Education and awareness about microaggressions are key. So is encouraging people to reflect on their emotions and speak up and promote respectful dialogue. Some strategies to promote a respectful workplace culture are to foster inclusion and cultural intelligence. When people recognize their unconscious biases and their hurtful effects, and we couple this with increased cultural intelligence, we can make great changes happen in the workplace.
The next question we received is, what can I do if I contributed to a microaggression in the workplace? First and foremost, do not laugh, minimize, or dismiss it as a joke. Take ownership of what you did and acknowledge what has occurred to your colleague. Focus again on the impacted person. Don't try to explain or downplay the comments by rationalizing it. Instead, remember to practice your active listening skills.
Thank you, RSNA, for this opportunity.